Good afternoon, everyone. My name is Stephanie Williams. I'm a respiratory therapist and the Director of Community Programs at the COPD Foundation. We are happy to have you with us today. We've been joined today by a panel of experts, and they're going to be answering some questions that you all submitted. So let me take a moment and just introduce our speakers today. Dr. Valerie Press is Assistant Professor of Medicine and Pediatrics at the University of Chicago. Dr. Press also practices as a hospitalist in Chicago and has been treating patients during the COVID-19 pandemic. Then we have Dr. Barbara Yawn. She's the Chief Medical Officer of the COPD Foundation and guides us in a variety of projects. She has a strong background in research as well as in family medicine. And then we have Dr. Byron Thomashow. He's a professor of medicine at Columbia University Medical Center in New York. Dr. Thomashow is a co-founder and senior medical advisor for the COPD Foundation. Thank you all for being here today.
Thank you.
Thank you.
Thank you. So we asked for some COPD community involvement, and we asked you to submit questions for today's discussion. And so the questions you will hear today are from our actual COPD community. So let's go ahead and get started if we can. Dr. Yawn, this first question is for you. And I'm going to read these as close to verbatim as I can as they came in from our community. Where I live, there are hair salons, nail salons, gyms, swimming pools, and other services that are opening up. What is okay for those of us with COPD? What places should we avoid? And then kind of to tag on to that, is it safe for people with COPD to consider expanding their bubble? Or are we all at such high risk of bad infections that we should stick with the smallest bubble possible?
That's great questions. I think that what we need to do is think about each of those areas. And whenever you think, gee, should I go to this place or this place? You need to think about the setting. Let's take a couple examples. For example, the swimming pool. Well, that depends a lot on the swimming pool. If you go someplace and you swim laps, and there is a lap lane for each person, and you can safely have a place to change where there aren't a lot of people around, you know, they clean it. I think that's great. If you're talking about going to the community swimming pool and it's a fairly small pool and there's 20 people or 50 people in it, no, I don't think that's a good idea. So again, you have to know some of the specifics. Hair salons, many of them are being quite careful. And, you know, if there's 4 chairs lined up, there's only somebody in every other chair, for example. So they are 6 feet apart. Everybody's wearing a mask. And that, I think, is very important. So those places you may go. Now, for example, the gym, yeah, I belong to a gym, but I'm not going to the gym. And I probably won't for a little while because there are a lot of people of a lot of different ages with a lot of different ideas about social distancing and masks. They're not all wearing masks. They're breathing pretty heavily, you know, when they do exercise, and they're not all staying 6 feet apart, and they're not cleaning all the equipment after each use. So I'm not real comfortable with that. You may have a very different kind of gym you go to, and then you'd be okay with that because certainly we do want people to still be active and exercise. So again, I think it makes a lot of difference to where you go. Of course, it may make some difference to who you are and how difficult it is for you to get there. You may, for the grocery store, for example, have them deliver your groceries if that's appropriate. But I don't want people to make their bubbles so small that they really are feeling isolated. Think about where it's safe to go. Byron and Valerie, what are you telling your patients about their bubble and how to expand it?
Well, from my standpoint, I think it depends a lot on where you are. I mean, New York, which is where I work, was obviously a disaster for several months, but it has calmed down. I think there's concern it's going to reactivate, but right now it's reasonably quiet. On the other hand, we all know there are many states and cities where that's not the case. And I think that the greater the risk of getting exposed, the more you got to keep that bubble fairly tight. The only other thing I would stress, Barbara, is outdoors is much better than indoors.
Yes.
You know, I think that's really a critical issue. And, you know, working out outdoors, exercising outdoors is undoubtedly a lot safer than indoors. Valerie?
Yeah, I think these are all great suggestions, and I don't have a lot to add. I think the only other thing I'd add is picking up on what you were just saying about where you are. So I was in Chicago where we were hit hard, not maybe as hard as New York. Things are a little bit better right now, not great, but better. So thinking about how long we have to live with this and the fact that things may wax and wane is adjusting your activities for that. So if you really, really, really want to do X, and as has already been mentioned, it can be as safe as possible. If most people are wearing masks, you limit how many people you're around. I love the swimming pool example with the lanes. That's a great example of a safer event than, say, a big swimming pool where everyone's screaming. It's relatively quiet. Maybe try and get something in now, whereas if things pick up again, then you pull back and you close that bubble up. So I think it's a waxing, waning type of thing, and it's just constantly adjusting risk. I've been having to give advice to my own parents and to my own family members and friends, and that's kind of, at first I took a really hard line of don't do anything, and that just isn't realistic for for months on end. So I've tried to adjust it on how safe is it right now for X. If this is safer now than it might be in a couple months and you really need it to be done, do it. So another example I get a lot of are health things like going to the eye doctor or going to the dentist and things like that. So again, it's how much do you need it to happen and how safe is it? And can it wait because it's not safe? Or is it really urgent and it's safer now than it might be in a few months? Weighing those kinds of things.
Yeah, makes sense.
And Valerie, I think you just brought up a really, really interesting point about health maintenance kinds of things. For example, I just went to get my mammogram, my annual mammogram, about 3 days ago. And they really, I checked before I went. You had to wear a mask. They had only a limited number of people. When you were sitting in the waiting room waiting, there were only 4 people in a very large waiting room with about 20 chairs. They took you back one at a time. Everything was clean. So please don't delay your health maintenance things that you need to have done without at least checking first and seeing if it is safe. And feel free to call your doctor or nurse and say, hey, I need this or that. What do you think? All of us are happy to give you specific advice about different kinds of testing. So that was a great point, Valerie. Thank you.
Oh, thank you.
Great, thank you all. So along those lines, Dr. Press, this question was for you. Is there any specific advice that you're giving to your chronic lung COPD asthma type patients?
Yeah, no, I think that's a great point, picking up on the conversation that we just had. There were certainly some questions early on some very specific COPD care. So one really common question was around the safety of prescribing steroids for an acute exacerbation. There was some early concern that steroids could be dangerous in patients with a COVID infection, and what do you do if people have COPD and may have COVID or may not? And luckily for us, the GOLD guidelines were on top of it. They definitely suggested continuing to give steroids if needed for an exacerbation. You have to weigh the need for those steroids now with an exacerbation and the potential risk. And more information has come to light about the safety of steroids. It's still being investigated, but overall, the recommendations are to continue to feel safe taking steroids if needed for an exacerbation. There are other specific things that are relevant to COPD. There's concerns around nebulized inhaled medications, aerosolizing the virus. So if you happen to have COPD, you usually take medications using a nebulizer machine and you live with others. Is there some risk that could get, more risk to the loved ones that you have? So there were some efforts to try and switch patients to inhalers to give those medications instead. I think for my patients, that's a patient by patient discussion. There's lots of reasons why inhalers don't always work well for patients, and there's a reason that they're on the nebulizers. I will say in hospital settings and clinical settings, we are being careful around nebulizer use for the safety of the entire population. I think another COPD specific type question is balancing trying to keep yourself safe versus needing care. And this kind of came up before around health maintenance, but also in an acute exacerbation. there's concern that a lot of individuals are delaying acute care and chronic maintenance care out of fear of being exposed to individuals that are infected by going to a healthcare institution. I think some carefulness is important. So if there is a question you have or care that you need that can be handled by a phone call or video visit, that's great. I think I'm starting to have an early exacerbation. Could you prescribe me some medicines, or what should I do? But if you're really in trouble, you need to get to that healthcare, whether it's through primary care, clinic, an urgent care, or an emergency room. I think that that's what I really can't stress enough is we will do everything we can. And we know a lot more now than we did early on in how to keep patients safe and protected if they do present. So that's one of the things I really, I'm sure there's several others, but those are the three key things that popped into my head just now.
Well, one of the things that I get asked is if I am on a maintenance inhaled corticosteroid, is it okay to continue? And the answer is, please, yes, continue, because it's much better to take good care of your COPD than any very, very tiny risk, if there is any, from the inhaled corticosteroids. So that goes for asthma too, if there's somebody with asthma and COPD listening.
Outstanding.
Great, thank you. And Dr. Thomashow, I have a question for you here. This question says, it's about vaccines. So this is kind of a multi-part question. It says, my understanding that some of the more promising vaccines in development have side effects that are similar to coronavirus symptoms. This makes me wonder if they would even be given to persons with conditions that put them in the high risk category. And then a follow-up question to that, just very similarly, when you get a vaccine for the coronavirus and are they putting a live virus into your body? I don't think my body would be able to handle that. So could you just speak to the vaccine issue and some questions around that?
Sure. Obviously, vaccines are a really hot area here. If we're going to get on top of this, the sooner we can get a vaccine, the better. So that's number one. Number two, as I think all of you know, it oftentimes takes years to develop a vaccine. Behind the studies that you have to do and the safety measures you need to get, it oftentimes can take years. This is being expedited across the world to try to move faster to it. And the good news, and there is a little good news, is that we weren't starting from scratch here, because there were prior coronaviruses, SARS, MERS. These were different viruses, but they were all in the coronavirus family. And so there had been some preliminary work done with vaccines. So that sort of gave us a head start moving forward. And that has allowed us to really trigger this to a much faster speed than I think most of us thought it would. As far as the type of vaccines that are used, there are two major types and now a third. There are live vaccines. That is what mumps, measles, rubella, chickenpox, these were in general live vaccines. They are weakened. They are what we call attenuated, so they don't carry the same risk of getting the infection. They are attenuated vaccines, weakened live vaccines. And the idea is to trigger a significant immune response. Because they're weaker, they generally can't cause the disease. But live vaccines, if anything, require even longer periods of study to make sure that they remain safe. There are inactivated vaccines, so-called killed vaccines. That's what the flu shot is every year. That's also what the hepatitis vaccine is. So there are several killed vaccines. In general, killed vaccines may be a little safer because you don't have that quote-unquote live issue, but they also don't tend to generate the same sort of immune response that other vaccines will. So those are two types of vaccines. But there's a third one, which is now, which to as far as I know, and Barbara or Valerie may have other comments, has never really been approved before. They are genetically motivated vaccines using protein things, RNA, for example. And that is a major factor in some of the vaccines which are presently being developed. And it's based upon, to some extent, the way the coronavirus looks. It's sort of like the term corona is a crown. And if you've seen the pictures of the coronavirus, it looks like a crown. It's because there's an S protein that exists on the surface that then binds the tissues of normal cells. If we could block that, and that's what the attempts are, then you could make real progress. And there is some really good news here now, in the sense that even today there were some publications in the Lancet of some of the newer vaccines, the Oxford vaccine, for example, that's being used, which suggested that it was successful in generating a fairly significant antibody response, and in addition to that, seems to generate an increase in T cell formation. That's a type of white blood cell that could serve to kill viral illnesses. So both of those factors seem to have been generated in what is clearly still preliminary, but potentially very exciting. And the side effects, while they were certainly present, were relatively mild and seemed to go away by themselves and controlled. So getting back to the question, which is a good question, it depends upon the type of vaccine that is generated and which one will tend to be the safest and generate the greatest immune response. I think that the key here is we need to get that vaccine, it needs to be safe, and we need to put it in production earlier rather than later, so that when we prove that these things work, we can really make a difference. But one of the many things we have had progress in here, Stephanie, is that we have seen real progress in developing a vaccine.
And Byron, there is, for example, the shingles vaccine, the newest of the shingles vaccine, which is a recombinant vaccine, as you mentioned, and it has an adjuvant, which is something that kind of ups the immunogenicity or the immune response. So we do have one out on the market. And some of the good news with that one is that it's quite effective in older adults. And some of the really old adults like 80 and 90-year-olds, as well as those younger, older adults like we, in the 50s and 60s. So that, I think, is very good news, because people have worried, is this vaccine going to be okay for 30-year-olds, but not have an immune reaction in 60-year-olds? What's your comment about that?
I think that the three keys with vaccines is A, that they be safe. I think that, and as we speed through with this, we need to make absolutely sure that they're safe. The second is that they work, that they provide an antibody level that lasts. One of the things about inactivated vaccines is oftentimes, like with the flu vaccine, you need to be vaccinated repeatedly to make sure that you stay up with your immune response. And the third is exactly what you've just said, Barbara. There's always been concern that older people who really would need it more than anyone else, may not get that same sort of immune response. I think all of those issues need to be looked at going forward. Valerie, any thoughts?
Yeah, no, I think that's outstanding. I think the only other thought was sort of getting at that are which populations are being tested initially for the vaccines, and then when are we going to learn about other populations? So typically, say women who are pregnant, children, maybe older adults are often part of the early testing for safety reasons and other, ethical reasons to protect individuals. But those three pillars you just mentioned, I think as we learn more, we need to make sure that this vaccine works for everyone. I know there was some initial concern that some of the early testing has been not amongst the most diverse group of patients. And it's really important that we are inclusive ultimately in all of our testing to make sure that we know it works for individuals.
Yeah, I think that's absolutely really important, Valerie. I think the other thing that many of us have concerns about, as I think we all know, there's been a lot of antagonism about vaccines now for a number of years. We are dealing with a pandemic that I've never seen anything like, and getting a vaccine that's safe and works is really important. But if it's only used by a relatively small percentage of the population, that's not going to help us get to where we need to be.
Well, and I think your comments about people worried about vaccines, they need to continue looking at the data and the evidence instead of just hearing somebody's story of, I think it was a problem. The data and evidence for almost all vaccines that we use regularly is superb. They are first and foremost safe. And I think that's, as you said, what we're going to keep looking for is safety first.
And there's a lot of work being done. I think there are some 140, 150 vaccines out there. Now, only a relatively small of them are now proceeding to the largest studies that we need. But it just goes to show you how much movement there is in trying to push forward. Because ultimately, I think that's probably our best chance. I mean, we've all talked about herd immunity, and I think that the likelihood that the number of people infected in a population is going to be large enough to develop that is not as likely as I'd like.
Thank you so much. Great discussion. Thank you. Dr. Yawn, I'd like to go back to you for just a second. Question for you is, could you talk about the advantages or disadvantages of face masks versus face shields?
Sure. Face masks are something that covers specifically the nose and mouth, and they are fitted so there is not a lot of air moving underneath them. It moves more through the mask. The face shield, on the other hand, all by itself is usually just a piece of plastic you put over your face. It's used in the hospital setting, and Valerie and Byron can comment on that in a minute, but it's used mainly in the hospital setting, or for example, if you go to the dentist's office, where they might be getting something into their eye, for example, and you don't want to do that. But it really doesn't provide a lot of protection for your nose and mouth and the respiratory tract. If you watch, everybody who's got a face shield on is also wearing a mask. So it is the mask that is the most important. It is unlikely, as far as we know right now, that most of us just walking around are going to get something directly into our eye. Now, a dentist might, or someone in the hospital who's intubating a patient, or the patient is coughing right in their face, maybe. So the face shields are for that, not really for the average person like me walking around and being around other people, or being in a grocery store or some other setting, or a doctor's office. One of the other questions that I think I frequently hear is, what if I have trouble breathing through the mask? Well, I think a lot of people do when they first put it on. I want to say right away that N95 masks are frequently very difficult to breathe through, and they're really not recommended for the average community population. But the cloth masks, you put 2 or 3 layers of cloth, and they can be a little difficult to breathe through. Sometimes people also feel a little panicky when they first have their nose and mouth covered. And so I suggest, if it feels uncomfortable, you could start with small periods of time. Put the mask on when you're at home, just sitting there, and then do something to distract yourself, whether it's getting on, I don't know, Facebook, or watching a TV program, talking to somebody, reading a book, something that distracts you from feeling so anxious, and see how well you can do. Then try getting up and moving around with a face mask on. It may be that you can only walk a little ways at first, and then you can increase the amount of time the face mask is comfortable for you, until you can feel like you can go out and take a walk, or go to the grocery store, or the beauty shop, the hair salon, whatever it is. But I do think that it is face masks. They are extremely important, and they are readily available now. If you can't make yours, sew it. Not all of us are good at sewing. There are many, many that are available at quite reasonable prices. So I'd be interested, Valerie, any comments about face shields?
Yeah, I think you explained that really well. I see face shields as an add-on, and like you said, for those instances where you're really concerned about the eyes, but not for the nose and mouth, as you said, because it doesn't provide that tight covering. And in the hospital setting, we typically will try to cover our eyes. For those of us that wear glasses, some people think that's enough. otherwise goggles or face shields for those close encounters that involve episodes where something may come out of a patient's mouth or nose. But for the general public, I have seen a few people wearing them, but usually they are also wearing a mask to cover the mouth and nose.
The only other comments I would make, guys, is that the N95 mask is obviously more effective in preventing actually getting infected. There are still, despite 6 months, a limited supply of N95 masks. I don't know, Valerie, where you are, but we're still reusing N95 masks, which is not something I ever thought we would do again. It is harder to breathe through an N95 mask. It's also important that people understand that when physicians like Valerie and I, we get fitted for our N95 masks every year. If it's not fitted right, it doesn't work that well. So having it broadly available is complicated and problematic and really not that necessary. Face masks work. There is no question about that now. And I suspect that all of us are concerned that it somehow has become a political issue. That's silly. This is a medical issue. It is the best thing we have, short of, on top of separating, giving some decent social distancing, and it works. We need to, if everybody started wearing a face mask, there's a reason why so many of the countries in the Far East have done a better job than we have, because for years that's been part of their existence. Face masks work.
Well, yeah, and I hear people say, well, I don't want to wear a face mask. I don't care. You know, they're not wearing it just for them. They're wearing it for me.
Yeah.
And I'd like to say that I think I matter, and I would appreciate it if they would care enough about me and the other people in their community to wear the face mask. And the other thing that we haven't mentioned is washing your hands. And all of us know that, yes, face masks are very important. Social distancing is very important. But when you get home from being outside or at the grocery store and you take your face mask off, go wash your hands. It's really important to keep that in mind too.
Yeah, I want to stress, I think what you just said, Barbara, is absolutely correct. And yes, we understand that the face mask protects others, perhaps more than it protects yourself. But what I found, like a lot of other people, I have the habit of touching my face. I'm much less likely to do that if a face mask is present. It really can help.
Yep, it helps our habits.
So thank you so much for joining us today. Again, if you have any questions, you can visit our website at thecopdfoundation.org and visit our section on the coronavirus updates. Thank you, and bye-bye.